On this episode, we continue on from part one's discussion with Nieves Murray, Suicide Prevention Australia's CEO. We talk about mental health and the virus and everything going on inside Australia. Also social distancing versus physical distancing, staying sane during all of it, schedules and routines, and a whole lot more. With that said, let's jump straight into the show. I'm Hayden Perno, and this is the Philosophy Podcast.
Because the risk is that you can very easily fall into the trap of working continuously and not taking advantage of the fact that you've reduced your commute or whatever it happens to be. I have to say I spend a lot of time speaking with my team about what they're doing and how they're coping, and many of them are taking breaks in the middle of the day. So they've moved their exercise from the morning or the evening to the middle of the day so that forces them to get out and move. And I think that's not all employers would be as focused perhaps as we are on those sorts of things, but certainly ensuring that our employees are looking after their physical and mental health is important to us. We deal with a pretty tricky topic as part of what we do, so making sure that we're as balanced as we can be is important.
Hopefully this does sort of revolutionise office work, so people can start working from home. People are encouraged to leave the office during their lunch hour from now on, like after all of this, because even like in regards to people, I guess decreasing the size of their office space, they might not need that top floor huge office anymore. They might go, oh, hey, let's like save some money, get a smaller place. Everyone can sort of work out of home Monday through Wednesday. We just have to meet twice a week.
Oh, that's certainly something that we're considering in our organisation, certainly moving to smaller premises. That said, I have a number of employees who are really struggling not being with their work colleagues, they're stuck at home. Their home environment isn't good, right? So they might be sharing with someone, particularly our younger employees that don't own their own space. They're sharing in a small apartment. There's two of them trying to work. Their roommates, they're not partners, so it's really tough. And for that person in particular, we're finding alternatives so that they can utilise an office space or somewhere where they can get away from their home environment, because the home environment sometimes isn't conducive to work and not a place that people want to be. And that's a consideration for employers as well, that there will be some employees who thrive working from home, but others that cannot. And I think that's the key that will change for empathetic employers, that they will give people the flexibility to work in a way that best meets their needs. And for some that may be an office, and for others that may be from home and the occasional meeting or hot desking from an office space. But I have my biggest fear out of this is that we will return to status quo, and that there will be no significant change in the way we work, in the way we live, in the way we treat each other. That for me is by far my biggest fear, that we'll take our hand out of the bucket and the water will just go back and everything will be as crazy as it was before. And and I think that will be an opportunity lost if we don't actually adjust the way we live and the way we relate to each other.
I think it's going to be somewhat like that. It'll be like how, when you go away overseas and everything's crazy and different and you're every day, oh my goodness, what's going to happen? And then you come home and you've got there's that window of everyone's different and you sort of feel out of place, like you're not supposed to be there. And then 2 weeks go by and everything's the same. And you're like, oh yeah. And you're gossiping about Sally, and just whatever topics.
And people are worried about, the fact they haven't mown the lawn or whatever it happens to be, the minutiae of the day.
My milk ran out yesterday. Oh.
That's my biggest fear, that we'll all go back to being, less than having that heightened awareness of other people's needs, as well as, really what's relevant and what's important in life, rather than the minutiae of every day.
All right. I don't know if you want to talk about your social distancing versus physical distancing, because that was something we
Oh
spoke
yeah,
about in person,
absolutely.
and that was, yeah. I think we should just touch on that, and then we'll. I'm a bit conscious of the time. It's coming up to 4 o'clock, and obviously you've got another meeting coming up soon, so we'll talk about social distancing versus physical distancing, and then I've got some 5 bonus questions that we'll finish off with.
5 bonus
5 bonus
questions.
ones.
I don't know if I can give you 5.
I've got
Well,
them.
I
So
think
I've got the questions. So all you have to do is just answer them correctly. All right.
the right answer.
Well, let's talk about, because obviously with the big slogan that's going around, it's starting to soften up with the social distancing. So it's like avoid all human contact. And you're arguing, well, in person. Obviously, no one's seen that, but we were talking about the difference between the physical and the social distancing. So yeah, I thought I'd open up that topic, and you can have a.
I think it's a misnomer. I honestly think that, and I know that it's actually come from the World Health Organization. This isn't something that's just happening in Australia. The fact that they've coined it as social distancing, I think, presents some challenges, because we're not talking about social distancing. We're actually talking about remaining socially connected, but we're talking about staying physically apart from one another. And the physical distancing is essential so that we're not transmitting the virus. The social connection is important. So for us to say social distancing, in fact, creates, I think, a layer of complication and misunderstanding around what we're trying to achieve here. So the better terminology, in my opinion, is physical distancing, not social distancing. And if you consider what happens in the shops, we're actually physically apart. We're not socially apart. We're still kind of in society. We're still talking to each other. We're encouraging people to stay connected.
But people are getting a bit weird now. People are starting to be like, they wait 10 meters away from you, and you're like, I'm not going to cough all over you. It's not that bad.
Yeah,
They think that, like, as you walk, the plague's going to be floating around you and just kind of what is it? Coming out and touching everybody
exhaling, yeah.
just where you're walking. It's like,
Yeah.
um,
But it
one
is,
thing,
I mean, because it's an unknown and unseen,
yeah,
people,
of course, the invisible enemy.
yeah, that's right.
Mm. But with this, I've found that I've been speaking to a few people, and they've started to notice that their friends, or just the relationships in their life, are disappearing. They stop hearing from people that they always talk to. Obviously, people can't always be reaching out to every single person in their circle, because there's too many people. We've got, hundreds of friends on Facebook. You can't just be messaging everybody and spending your whole day whilst trying to work from home just contacting people. What do
I
you
think
think
the
about
other thing,
what do you think about how people are saying, well, I guess people's true colors are coming out now, and they're being more exposed?
I'm not sure that it's about true colours. I think it's more about incidental interaction. So if I think about, for example, the guy who makes my coffee at the train station, who I chat with every day, and I do spend I deliberately go early, I spend a good 10, 15, 20 minutes speaking with him. I don't have that interaction anymore. And I don't go out of my way to find a way to interact with that person, because it's an incidental relationship that isn't deep or meaningful, but important for his mental health, I'm sure, as well as mine. So essentially, I don't know about true colours, but I do think that people generally are lazier in making connections when it takes a bit of effort. And yeah, so that you can see those sorts of trends, people not contacting as often, and becoming more self-sufficient, so to speak, rather than relying on their friendships, because it takes effort. And for some people, that effort, they're just not prepared to put the effort in. So I don't know that it's about true colours, Hayden. I think that's probably...
It's a dark way of thinking about it.
Though there may be some people for whom that's the fact,
Yeah.
but I think the majority of people, it's just the effort it takes. And I know it doesn't take a lot of effort to make a phone call, send a text, but it's an effort.
I think there's also a component of how people perceive certain people in a way. They might think, oh, they don't need that connect. They don't need that contact. They don't need that message of, are you okay? What's going on? Because they just believe, oh, they're all right. They're always all right. They get through everything.
That's the other thing, that we make assumptions about people's resilience. It's interesting. We make an assumption, and I think we heard some very senior politicians making these comments around the bushfires. Fireys like to fight fires, right? Health workers like to care for people, right? But that's not always the case. It's sure they want to care for people, they like to fight fires, but the trauma associated with a crisis like this affects them as well, right? So it's you're right. We make assumptions about people's resilience because what we see is a strong facade or people who are just getting on with things. But in the quiet of their own space, and sometimes they're struggling too, and we need to check on our mates. I think Are You OK has a slogan about first responders, and the question is, are you triple OK? Because they've got their own issues to deal with, they're also dealing at the front line with some fairly traumatic circumstances. And we do need to make sure that they are okay. I think don't make assumptions that someone who always appears to be resilient is coping okay.
What is going on with the bushfire victims? It seems everyone's just forgot about it.
One of my favourite hobby horses, actually, because what we're seeing is compounded distress for those people in communities that have been fire affected and now dealing with the ramifications and implications of COVID-19. So we've seen their homes destroyed, they've seen their businesses destroyed, and now they simply can't move forward. So this is, it's a challenging time, particularly in New South Wales, where we've seen, massive impacts with the bushfires. What the government has done in New South Wales, though, is appoint a resilience commissioner. That's the first, as far as I'm aware, internationally, resilience commissioner that's focusing on communities that have been hit three times with drought, fire, and now this. So the government is aware of the compounding nature of this, and we are seeing some really innovative solutions coming through. That's not to say we can't do more. Of course we can, but at least there's a recognition.
That's good. I feel bad for the people that are living out of tents going through this still. That's I tried to... Yeah. I wanted to end positive and we went solemn again, but let's get to the...
It's quite challenging. And if you think about the homeless people too, we've found one good thing about this, if I can, sorry to take up your time, but good thing about this is that we've seen, because of this crisis, like now there's a burning platform. We've seen this crisis make us do things that have been too wicked. The problems have been too wicked for us to address, like homelessness. We've now got people sheltered. We've got them looked after. We're now getting contemporaneous and current data around a virus, and we're tracking it and we're collating all that data across the country. Imagine if we could do that with suicide attempts and suicide risk, that we actually utilise this technology that we're now using to track a virus to help people who are in suicidal crisis.
Hadn't even thought of that.
I see that the utilisation of technology to find solutions to this huge burning platform, difficult challenge that we've got as a community, we can deploy this new way of doing things across a whole range of different areas. The fact that we've focused on JobKeeper and JobSeeker, we've increased the funding for people who are on New Start, all of those things that are supporting people right now. Imagine if we could do that when there wasn't a burning platform and actually look after people better.
That'd be such a good initiative. Hey, as soon as somebody's registered as known to have those medical conditions, mental health conditions, they're straight away put in the system or whatever. That's perfect. Yeah. That'll help a lot of people. Even just they can start to send out emails or whatever to these people, come to our meeting on this Friday, our live event where we just talk amongst one another.
That's right. And look,
so there's
actually an expert advisory group at the Prime Minister's level, Prime Minister and Cabinet level, that the Australian Institute of Health and Welfare is running in association with the ABS, that we're advising currently. And I'll certainly be pushing this notion of, we've now got the technology that we're tracking the virus. Every day we get updates on numbers, on places, on the control factors, etc. Now's the time to extend that technology and know-how and capability to other issues in our community.
Yeah, people are a little bit concerned with this tracking app actually, but there are definitely positives to it.
Yeah, it may not be tracking. It may be a different way of collecting data across jurisdictions. One of the challenges we have in suicide prevention, as an example, is that the data doesn't become available till 2 years later, once the coronial inquests are all completed. Imagine if we had contemporaneous data around attempt information across every state, as opposed to every state doing something different. So there's a whole host of collaboration that we're now seeing that across layers of government we haven't seen before.
That is a positive we're going to end on then. All right, let's get to the main event, the 5 bonus questions.
Oh, no.
I want true and honest answers only. All right, first question. Are you more productive in the morning or the night?
Night.
Really? And you've been shutting off your computer at 6:30?
Yeah. That's why I'm more productive.
That says
I'm knitting like a nut.
Yeah, true. What's your priority at the moment?
That's right.
Do you prefer smooth or crunchy peanut butter? This says a lot about a person's character.
Crunchy.
Yeah, good answer. Do you wear socks to bed?
No.
Why?
Because I don't wear anything to bed.
Okay.
Why are you blushing?
You're the one. I'm fine. Look, I'm fine.
I'm not blushing.
Yeah, I think wearing socks to bed is weird. So that's why. All right. What is your ideal superpower?
Oh, Ideal superpower. Ideal superpower. I don't know. I need more time to think about that. I would like to say increased and improved listening.
That's a good one. I didn't think you'd say that. I thought maybe invisibility or something.
No, I don't think invisibility.
Increased listening. But then you'd go crazy. You'd just be overwhelmed by how many conversations are going on around you. If that's all you could do is hear people.
Maybe to be better understood, maybe to articulate more clearly so that people understood better.
Okay.
I want to say something really corny, like...
bring it on, let's do it.
Yeah, homelessness really disturbs me, especially in Australia. And if somehow I could I'd address that issue so that people always felt safe, that would be something that would make me feel like I'd contributed.
That's a good power. That's a nice one.
Mm-hmm.
All right, and the last question, what are you reading currently, if you are reading anything? Besides the news.
I'm reading a lot of strategic plans.
Mm-hmm.
I'm reading in Spanish.
Good. What are you reading?
I'm reading a book by Jesus Carrasco, and it's only a small novella. And so yes, it's stretching my brain to read in Spanish.
What was the title, or did you say the author?
I said the author, Jesus Carrasco.
And
I don't even know the title of the book.
You don't know the title? That's all right.
Yeah.
Cool. Very cool. All right. Well, Mrs. Murray, thanks so much for coming on again.
My pleasure. It's almost 12 months, I think, since last time we spoke.
No way.
It is.
You're probably right. Yeah. I think May or something last year. Yeah.
Yeah.
There you go. We'll lock it in. Yearly event, an annual conversation.
Yeah. An annual dialogue.
All right. Well, I'll let you get back to your work. Thanks again for coming on.
Pleasure. Thank you.
Well, I hope you enjoyed that discussion. If you've got any questions or comments, be sure to head to panosophy.com. You can also head to her organization's website, suicidepreventionaust.org. You can track her down on Twitter at Nieves Murray, and I'm going to leave a whole lot of links below, so be sure to check out the description. I guess that's about it for this week. Thanks so much for tuning in, and I'll talk to you soon.